Thank you, Dr. Ashish, for giving me this opportunity to be part of this very, very important area, which is evolving in a big way, which has been talked of. So I'm just going to give you, I think I must say here that I have some financial disclosures here where I do at this stage now as a speaker for them or sometime attend their meetings. I think once we talk of biosimilars in the country, what we started with Razumab, and then Reni-Ice, and now Ranizuril. So I think these are the three. Of course, some companies are sort of sharing the product. That is what is happening. And one thing is there, that as far as the anti-VEGFs are concerned, only Ranibizumab biosimilars are approved at this time. I think there's a lot of work going on aflibercept biosimilars. So there are going to be a lot of competitions in future. So it's going to happen, but they still have a patent restriction. And so I think if we look at various trials which have been done, especially for drug approval, they have almost like been similar. Maybe patient numbers are different, but that's how probably the approval was possible from DCGI for all the three in this country. And as far as the real world data is concerned, I think it was not 7 years, now it is 8 years now as far as the INTAS is concerned. And it was right in the beginning, 2015, approved for almost all indication, except the additional approval was for ROP subsequently. I still remember, I think Manish is here. He has turned gray when he would visit us in PGI, and we would not use it. You see, that is what happens, and that is a hesitance. And of course, we have a same hesitancy with the later two, Ranizuril and Reni-Ice. We want more people to use it and then become confident. I tell all the time whenever the people are visiting us. And I must say, as far as the this ROP indication is concerned, this Janani scheme by Government of India, you see now these days everybody is injecting Razumab in ROPIs. And that is itself, data should be shown from this country. And I'm sure the data would come. And I think as far as Ranizuril is concerned, I have already shown this, that they have shown safety as well as efficacy. The total injection used may be around 15,000 or maybe a little more than that now. And also for the Lupin, this was maybe the numbers have gone beyond 15,000. And do we have most of the data? I think it comes from this country only, and mostly where Dr. Ashish and his team has been associated, as well as some of the other data which we saw already today from Debulal. I think we need to be kind of going into that kind of exercise where we generate data, we have evidence. That is what is very important, and that's how it will become a global phenomena. And I think this one particularly here talks about, again by Ashish and group, where they talk of ophthalmic biosimilars from India, and this was in 2019, and a lot of things have, and even VRSI has done a survey, and what that survey revealed, that Indian vitreoretinal specialists are familiar with anti-VEGF biosimilars, and there has been now progressive trend, like what I mentioned and show to you, that we are accepting and using biosimilars over biosimilars, and there is a need for enhanced pharmacovigilance. I think VRSI did have that kind of adverse, still they have adverse event kind of a site where they look at, so that part is very important always. I think basically, the Razumab, when it was launched, 45% cut, then the Lucentis, then price cut has gone up to 66%, and others also like almost similar. And the prices of the innovator, because of the same reason, they had to bring down. There was no other way. They would have probably otherwise gone out of the... This is just showing, this is, my son is now consultant in PGI. I just asked him, just give me rough data from what you do with this. So you can see here, this is a big institute where I've worked all my life. So out of the like 40, which he uses himself, they have a large team. There's so many of them. There may be more than 10 consultants. So 20 are Razumab, 10 Eccentrics, 5 to 6 Eylea, 3 to 4 Ozurdex. So why I'm showing this is where the place, I think Manish couldn't come, and all indications, you can see all indications are shown there. You know, they entered with great difficulty in October 2021. I superannuated in 2019, and that is the Garewala Institute. And so I asked my people just to take out the data. So Razumab has gone up. That is the number one. So it 981 since then, and you can see Eccentrics and Eylea because of the scheme. Ozurdex and Paginex is really low there. I think we're still not using. I just wanted to show, look at this 82 years gentleman, how well he did with 3 injections. So that is seen here, and the vision improved. You see, that's how the confidence is built. And this patient, since this is something where he's paying out of the pocket, he is going to keep on getting and that is what he's doing, injections. This gentleman, this was with me from PGI days. You see, every time this wound never dry, and because he was not receiving enough injections. So it is 660, 624. It was something I told him. Okay, we have this new drug, which is cheaper, and I'm going to give you 6 injections. And it's unbelievable. You can't. He's the happiest man today. After 6 injections, both eyes become dry. Look at his vision. Now, his near vision has also improved. And somehow, now his requirement is every 4 months or so. I mean, which is unbelievable. So I think things are happening, and vascular occlusion, we're going to listen from our keynote speaker here, and just within 1 injection, it shows beautiful, you see, resolution. So in summary, from a very slow start, which I mentioned already, and I think today the confidence has been built. And we had a problem, and this problem was that inflammation which happened, and it happened a couple of times, and we won't use it. And once we have large number of patients, they have already more than now 5 lakhs already done in this country, the numbers are going to increase. And I liked the suggestion by Nilesh, if they kind of incorporate that thing into the main market, more user would definitely be there. And safety is established. And there's no doubt that biosimilars are the future. And that has happened with other drugs in our country. How to adhere to the treatment. The cost is very important, where people pay out of the pocket. So I think that is where we are. But if we have more data, it will become a worldwide phenomenon.